Good morning, all. Today I am taking a lecture on uh, HIV positive plus converted into the AIDS and inflammation and some aseptic technique and some extent about the department how we have to maintain the department hygiene. Okay, so first of all, I want to start with HIV or AIDS. Okay. So, what is HIV? HIV is a human immunodeficiency virus that causes a deficiency in the human immune system, and that causes the main problem to the person to fight with the infection. And second one is called as AIDS. AIDS is a progressive disease of HIV, and its full form is acquired immunodeficiency syndrome. That is a fatal illness that is caused by the retrovirus that is called the HIV. It breaks down the body's immune system and leaving the patient vulnerable to the host of the life threatening to the opportunistic infections, neurological disorders, and unusual malignancies. Uh, Second thing, in the organism which is very much prominent in the HIV, that are the bacterial, viral, and protozoal, fungal, and skin parasites. You can see that on the this screen. You can see that some bacteria is very much um, prone for the like syphilis, chlamydia, and the making of the chancres, genital herpes in viral, HIV, again hepatitis B, and protozoal disease, trichomonas, fungal candidiasis, and skin. So the common STD disease and disease causing organism that can be more prevalent. Okay, so this is about the structure, that is of structure of HIV. Okay, so in the HIV structure there is a reverse transcriptase enzyme along with RNA, and some important features like they have a core protein like P24 reverse transcriptase and GP120, and one important thing, GPP7 is the main part of this structure, and in which the reverse transcriptase enzyme cause a major role for the formation of single strand DNA. So, about the epidemiology or the virus, that is male or female, occurs in the all ages group and ethnic group, and all areas of the country they are affected. Sorry, AIDS is now second leading cause of the death for all man, almost the age of 25 to 44 years, and that is also causing the heart diseases for the some age group. Okay, and mainly mainly the this HIV, that is of RNA virus, which replicate actively during the dividing T lymphocytes, and unique ability of to destroy the T4 cells, and reservoir, that is once a person get infected virus that remains in his body lifelong, and the person is symptomless carrier for a years before the symptoms can actually appears. The source of the virus is found in the great concentration in the blood, CSF, and in semen, and in the low concentration that could be found in the tears, saliva, breast milk, urine, cervical area, vaginal secretions. And they can also isolate it from the brain tissue, lymph nodes, bone marrow, etc., or from the skin also. And however, only the blood and semen are the known transient of the viruses, but they present all over the body. If you want to discuss about the host, so the host are mainly the most cases are actually sexually active group, that is called the 20 to 49-year-old, and High risk group is a male homosexual or the heterosexual partners, although they are the mainly of male homosexual, and IV taking drug taking and blood transfusion recipient, hemophilics, and the patient that having the sexually transmitted disease. So they are the main those who are mainly targeted. Okay. Now the HIV transmission, that HIV enters the bloodstream through the open cuts, breaks in the skin, mucous membrane, and direct injections. And route of the transmission of the HIV is a sexual contact, that means male to male, male to female, or vice versa, and female to female. And the blood exposure, that is injecting drug, uses needle and sharing, and occupational exposure, transfusion of the blood products, and perinatal, that is a transmission from mother to baby, that is breastfeeding. And um, occupational transmission is also there. That means they are more prominent in the healthcare worker, hospital staff, laboratory workers, and some other routes could be the organ transplantation, artificial insemination, needle prick. Okay. An incubation period is from HIV infection till development of AIDS. It is from a few months to the 10 year or even more. However, that is estimated that 75% of the people infected with HIV will develop AIDS at the end of 10th year. Okay, so HIV virus that multiplies in the T cell and that infects the T cell, and HIV virus that liberated by the busting of the cells from the liberation from these cells, they will again um infect the other cells. The clinical manifestation about the HIV is the initial infection, asymptomatic carrier state, AIDS related complex, and AIDS. In the initial infection, except for the generally mild illness of the fever, sore throat, and rashes, which is about 70% of the people experience a few weeks after the initial infection, most HIV infected people have no symptoms for the first 5 years. However, they can infect the other. Once infected, the people are infected for the life. Antibody response usually takes 2 to 12 weeks to appear in the bloodstream. The period is called as window period, and in this time the test remains negative. Okay. So the initial stage and intermediate stage and illness stage, three phases are there on which the HIV can transmit it. As shown on the screen, that they are transmitted through the mainly from the blood, like blood, semen, vaginal fluid, and breast milk also. Uh, one one slide also showing that they are not transmitted through the different things. So we can see that. And the acute HIV syndrome is for that is follows the 6 to 3 weeks following the primary infection, in which what is it? In which the systemic infections are fever, weight loss. Central is a malaise, headache, neuropathy, lymph adenopathy, skin rashes, nausea, liver and spleens is involved, and muscles is myalgia may be there. In the esophagus, the sore throat is there. In the mouth, some sores and some thrushes are also seen. Okay. So you can see that the stages of the HIV disease is a primary infection, asymptomatic, symptomatic, and advanced disease also. Okay. So the asymptomatic carrier state, in which the infected people with antibiotics as on with antibodies but without any overt sign of disease, except persistent generalized lymphadenopathy, and then are not formally clear about how long does it the symptomatic stage last. Now, AIDS related complex, that is an illness that is caused by the that causes the damage to the immune system, but without the opportunistic infections and cancer associated with AIDS. They may be exhibit unexplained diarrhea that lasting more than a month, that causes fatigue, malaise, loss of weight, and fever and night sweat. Sign of the mild infection like oral thrushes, generalized lymphadenopathy, enlarged spleen, and common manifestation of the AIDS when the HIV infected person then change into the AIDS patient. So what will happen? The symptoms are appears and main in form of AIDS. So the lung infection is due to the pseudom that is carinine pneumonia, and gastrointestinal infection that is due to the candidiasis of mouth or esophagus, skin infection due to the Kaposi sarcoma, red or violet, macules or papules, central nervous system infection that is toxoplasmosis, and dementia, meningitis, primary CNS lymphoma, and progressive multifocal leukoencephalopathy. And about the epidemiology of this disease, that they are the we can say that they could be the demographically and economic, behavioral, social, model age, racial deposition, sexual difference, health system issue, cost, trends in the fertility, and case management, early detection, surveillance and reporting is required. About the HIV, that causes a contributors of HIV risk, that is uh, macro level is rashes, stigma, poverty, gender inequality, migrations. So, individual susceptibility is also very much important, because structural level, that is resource ability, physical environment, organization system, and community level, that is community norms, social networking, and individual level behavior, attitude, knowledge, that is due to the this group. So about the prevention of this disease and um the primary, secondary, and tertiary. Primary HIV prevention refers to the actively focus on the preventing uninfected people becoming infected. Okay, so awareness and screening of the patient, HIV positive carrier, and AIDS patient from the healthy person. So the person newly uninfected person cannot infect, and they will remain separated from the infected person. Secondly, HIV prevention aims to enabling the people with HIV to stay well. The testing to all people to know their status, welfare, right advice, and lifestyle also. Behavior and anti-discriminatory lobby. And the tertiary HIV prevention aims to minimize the effects of the ill health experienced by someone who is symptomatic with HIV disease. That is prophylactic use of the drug and complementary therapies also. So when uh, we are talking about the HIV, so diagnosis is very much important. So just I am discussing about the diagnosis. HIV antibody test, that is using different antigens or with different principle of the test. Viral antigen test used for the screening of the blood donors in the country. Detection of the viral nucleic acid in the blood. Determining the CD4 counts to assess the disease progresses. And uh, testing is integrated counseling testing center, that is district hospital, medical college, free HIV testing, and confidential counseling, and antiretroviral therapy, that is useful. Okay. Some antiviral or antiretroviral drugs are also there, in which the zidovudine, that is important, that is available in India under the national program. Uh, One national program is running for the fighting against the HIV, and cost of the therapy reduced from rupees 30,000 in 1990 to the 1,000 per month in to the now number of the pills from the 32 to 1 pills from 32 to 1 or 2 per day. Okay, so in which the Zudin, that in ATZ, and Levudin, that is also available in India, and Istadovin, that is also available in India in national program. So person can go from that centers and collect the medicine. And about the prevention, avoid the multiple partners and the use of condom during the sex, and use of a sterile needle each time of the injection. Never share the needles. Avoid the unnecessary blood transfusion. All pregnant women should be tested for the HIV. And prevention, that is use of standard work precaution like hand hygiene, personal protective gears, proper disposal of the biomedical waste, and immunization against the HPV, and education is very much important. And about the occupational exposure, that is comes in the contact with potentially infectious body fields due to the uh, percutaneous injury, that is needle, stick, cut with sharp or object, contact with a mucous membrane, contact with a non-intact skin, or aberrant and chapped dermatitis. So how do you have to manage? So the management of the exposure site: do not panic, okay, and skin wash wounds surrounding with soap and water, and rinse well. Do not scrub, do not use antiseptic or skin washes, and splash of the blood, and eyes irritation with water or the saline irrigation, sorry. If we are using the contact lenses, leave it in the place while irritating. Remove once eyes clean, remove them and clean. Mouth, spit fluid immediately, rinse mouth thoroughly with the water and saline repeatedly. And we have not to use the soap or disinfectant for that. And for the total susceptible area, we have to use the PEP kits, and contact art specialists. Decision of the static PEP based on the exposure type and HIV status of the source, and decide the PEP regimens, that is basic regimen, drug combination, expanded regimen, drug combination within a 2 or 3 drugs. Okay, or if source person is on our drug, experts should be consulted after the starting the 2 drugs combination. In the basic regimen, we are started with a 2 combination of drug, and expand regimen, that is of switch to the uh, three uh, 3 drugs at a time. So post-exposure prophylaxis in India, that is recommended for the occupational exposure. It should be started as early as possible within 72 hours. ARV is given for the 4 weeks, and HIV testing should be done at the baseline, and 6 week, 3 months, and 6 months for the detection of the this test, and HIV from being virtual death sentence has been brought down to being a chronic manageable disease. So for all type of this um, infections, hand washing is very much important. So again I am saying about for the hand washing, how we have to do, that is a cleaning of pro- proper handling and cleaning of the things. So you can see that with soap and mild soap. So there is enough 3 or 4 steps, very much important. You can see that. You can see. Now the step, you can see that first step, second step, third, fifth, fourth, fifth, sixth and seventh. According to this, kindly go through it. According to that, we have to um, go through it for the washing. For the HIV infection control, the mainly the recommended practice of the HIV, that is of different, we have to follow the different policies and things which the government is uh, doing all in these times. Okay, so next I am switching to the asepsis. What is asepsis? The asepsis is the state of being free from the disease that causing contaminants such as bacteria, viruses, fungi and parasite, or preventing the contact with the microorganisms also. And antisepsis is a use of chemical solution for the disinfectants. Okay, what is about the antiseptic surgery? So the antiseptic surgery is firstly uh, isolate firstly used by the Louis Pasteur as a germ theory. Okay, and that's why he is named as a father of microbiology. And second one is very much important, Joseph Lister. He is saying there's a father of antiseptic surgery, because antiseptic word is coined by this, and the use of, because they have uses a lot of product from the carbolic acid, that means phenol. So asepsis is of two type, medical aseptic and surgical asepsis. You can see. So the medical asepsis is a clean technique that includes the procedure used to reduce the number of microorganisms and prevent their spread. And it is followed while the examining the patient, minor procedures like IV, cannula and insertion. And surgical asepsis, or the sterile technique, that is, it is defined as a complete removal of the microorganism and their spores from the surface of an object. The practice of the surgical asepsis that begins with uncleaning the object using of the principle of the medical aseptic, that is followed by the sterilization process. So, what could be the procedure for the surgical aseptic technique? That is measure of the minor surgery, that is tracheotomy care and dressing change and catheterization of the urine bladder, etc. And aseptic technique is employed to maintain the asepsis and protecting the patient from the infection and to prevent the spread of pathogens. And patients with infections on the carrier of the pathogenic microorganism are admitted in the hospital, and the hospital house large number of the people whose immune systems are often that is weakened. The medical staff that moves from the patient to the patient, that provide the way of pathogens to spread, and many medical procedure bypasses the body's natural protective barriers. So, so that is of asepsis, and you can see this flow chart. You can see that infectious agent, next is reservoir. You can see that um, exit route the organism is comes out, and how from there they are transmitted. Okay, then after the this come out from the body, so they again finding some areas for um, entry in other host, and finally if they found, and they will get enter into the next body to continue their this life cycle. Okay, So uh, that is the cycle of uh, asepsis. And the main principle of the medical asepsis is when the body is penetrated and natural barriers such as skin is bypassed, the patient is susceptible to any kind and any microbes that can be enters. Even though the intact skin is a good barrier against the microorganism contamination, a patient can become colonized with microorganism if appropriate precautions are not taken. And body fluids from any patient is considered contaminated. The healthcare team can and the environmental can be the source of contamination for the patient. And patient to determine if he has an infectious process and isolate the disease, not the patient. And the chain is as strong as weak link. So essential component of the maintaining the medical aseptic that includes the proper hand washing and utilizing of the gloves, gown, mask, and cleaning and disinfection of the equipment, handing lines in the way that prevents the germ from for the spreading, you know. And surgical asepsis is used to prevent the introduction and spread of the pathogen from the environment to the patient, and that is the procedure used to keep the object areas sterile from the microorganism. That sterile object must be free from the all microorganisms. Okay, so a lot of techniques can be practiced by the nurses or the by surgical uh, pro- the doctors and the surgical team, uh, those who are using, while the sterile instrument supplies are used. Okay, the working nurse with a um, sterile field with a sterile equipment must be understand what is the what could be the side effects, what could be the next step if this asepsis uh, is not maintained. Okay, so principle in the surgical aseptic is that always face the sterile field, do not turn back or side on the sterile field, and keep sterile equipment above your waist level or above table level, and do not speak, sneeze, and cover or cough over the sterile field, and never reach across the sterile field. So main thing is of that about the asepsis, how to maintain, and um, how we can use it. So a procedure that includes the surgical asepsis is a surgical hand scrub and donning a gown, applying and removal of the sterile grafts, and sterilization of the equipment also. Okay, so we have to do all these things for the proper maintenance of the asepsis. Next and finally, I want to explain about the inflammation also. So, what is the inflammation? Inflammation, that means a protective response that is initiated by our body. Okay, so that is a one um, uh, one definition. That is, inflammation is a protective response intended to eliminate the initial cases of cell injury, sorry, as well as the necrotic cells and tissue resulting from the original tissues. That is called the inflammation, and that can include the anaphylactic reaction, rheumatoid arthritis, and something else like that. And inflammation is terminated when the uh, uh, offending agent is eliminated and secreted mediators are broken down to the this dissipate. So this is on this these all are the definitions of this, in which the blood leukocytes, plasma proteins, and vascular walls and some connective tissues also play important role. You can see that These are the total cells which are using in the inflammation process. And now you can see that these type of process can be taken place within the body. The cause of the inflammation are many as and varied. That is, exogenous cause is a physical agent like mechanical agents, fractures, foreign crops, sun, and thermal states, burn and freezing. Chemical agent, toxic things and acid and bases. Biological agents could be the bacteria, viral and parasitic infection. Endogenous cause could be the circulatory disorders. Different cells are involved in the inflammatory response are neutrophils, monocyte, eosinophil, lymphocytes, basophils, connective tissue, fibroblast, collagen, and they are divided into the two group, that is acute inflammation and chronic inflammation. Okay, so just have a look about that. The acute inflammation, that is the rapid onset for the seconds, and chronic infection that persists for the longer duration. And acute infection is a relatively short duration. Main characteristics is the plasma protein edema and immigration of the leukocyte and neutrophils. And chronic inflammation, that is associated histologically and presence of lymphocyte and macrophages, that is proliferation of the blood vessels, fibrosis and tissue necrosis. So mm, this is all about the today's lecture on inflammation of acute and chronic. And just have a look about the what type of chemical mediators in the inflammation that is also responsible. So I hope that you are able to understand all the things. So thank you very much for being with me. Have a good day.